Good morning on a lovely Monday morning. The sun is sunning, so we're going to struggle with that today, but that's fine. Welcome to Dashboard Dissections. Again, I have no idea what episode I'm on. I'm doing really great at this whole podcast thing. Thanks. Today, I don't really know what we're going to talk about. I think we're just going to let the mind wander and see what happens. I guess I can tell you about my weekend. I was able to reconnect with all of my med school friends, and that was super, super fun. We had a great time. And we actually watched a majority of the Diddy documentary, and that's probably where my mind will wander today because, boy, that was eye-opening. And if you haven't watched it, you totally should, because it was nostalgic and really sad, if I can be totally honest. The nostalgia part of it was that I'm sure, like many of you, grew up or were adults with that music and with like the evolution of P. Diddy and kind of seeing all that in live time. I mean, all of that was crazy. And I guess I was saying to my husband yesterday that, like, to me, his conviction on only 2 counts was pretty sad. Granted, I wasn't there, and I'm trying not to give you any spoilers, okay, but his conviction on only 2 counts was very sad, and his treatment of people around him was really sad. And as someone who is in not really a similar situation, but as someone who is above a lot of people, it makes me really sad that people are taken advantage of that way. I just can never imagine reaching a point in my life or my career where I would treat someone that way. And I guess that's what's really hard for me to understand and to process. But again, I'm not a billionaire, so I'm not even close. So I guess there is some things that come with that amount of money, but I just feel like, I don't know. My friend and I were talking. The first episode felt almost really defensive. Like they were trying to explain in a defensive way why he became what he became. And that kind of left me with an icky feeling, and I almost didn't continue to watch. So if you feel similarly, push through, because it is really, really eye-opening, and it just continues to get like worse. And I didn't expect that. And the flip side of that is, it's so sad to me that there are so many people, mainly women, not only, but mainly women, that will take that kind of abuse because they've either been desensitized to it, or they just think that that's normal and part of the industry and like paying your dues, which, I mean, there is some of that in surgery. Like, we do take, in residency in general, not just surgery. I'm sorry, that was divisive. But in residency in general, there's a lot of similar behavior where you have to pay your dues. And older mentors are saying, well, in my day, I had to do this and blah, blah, blah. And, some of that is true. Some of that is required. I agree that 80 hours a week is something that you need, and if we're going to go less than that, then maybe we need more years of residency, she said after she already completed residency. Don't hate me, residents, I'm really sorry. But it's true, you simply cannot replicate time in the hospital and being kind of thrown into these scenarios that you have to manage and you have to figure out. And unfortunately, that's the best way to learn. So I can understand how some of these people, men and women, took this abuse in stride because they thought it was furthering their career, and they thought it was part of like not really a hazing, but like I don't know the word I'm looking for, but it was part of them paying their dues, I guess is the best way to say it, to get into this industry. And one person on the documentary, again, this is not a spoiler really, but one person on the documentary basically said that P. Diddy was one of the gatekeepers. He was one of the types of people that you had to go through to be successful. And again, I'll bring that back to medicine. Like, you cannot be a practicing doctor without going through at least a couple years of residency. There's a lot of nuance to that. But anyway, if you are an American medical graduate and you do 1 year of residency, then you can technically practice as like a primary care doctor. It used to be this way, and I'm not sure if things have changed. And then if you were an international medical graduate, if you did 2 years of residency, you could be a primary care doctor, meaning you could work in like an ER or an urgent care or some kind of outpatient clinic. But usually you can't work in the hospital. Now, like I just said, ER was on there, and so sometimes that is possible, but it's pretty rare. But anyway, all that to say, there are requirements for, wow, we're really going to struggle with that. There are a lot of requirements in order to be a practicing physician, and that's part of it. It's just like the gatekeepers. So even in any career, I'm sure there's something similar where there's like a gatekeeping pathway that you have to go through in order to get to where you want to be. And so I understand it. It makes me so sad that people have gone through that and dealt with that. But I mean, I have my own stories from residency that probably make other people sad. And, you know, that's just, unfortunately, it's sort of a part of life. And I'm not sure if that's just in the US or if that's something internationally, but it's sad. It's sad that people have to go through that. It's sad that that's part of the process of becoming a successful human being. I just really need to move this. Like, this is not, the sun is just not okay right now. I guess I need to figure out where else to put this. Sorry. So to me, it's like super important that people don't gatekeep and people help other people. And I think that's part of the reason that I remain pretty involved in my medical school. Now, again, what I do is not hard. I basically just tell people about my experience and tell people about how I got to where I am and try to help them in any way that I can. I feel like that gets harder and harder the farther out you are from the process, because even as I'm talking about this, I'm sure things have changed from the time that I was even in residency. You know, I mean, like, things change so quickly, especially in the I'm sure with everything, but especially in medicine, things continue to change constantly. And I was even talking the other day, because my group of med school friends, we were saying that we have almost every specialty covered, which is so cool, but we were talking about COVID vaccines and how much all of that has changed and is changing. So sorry, that was a little squirrel brain about the COVID vaccine, but it is super important to continue to mentor, especially in a career that is difficult. And not to say that I have it that hard, I really don't, but being a woman in a surgical field, which is still to this day a male-dominated field, it is difficult. There are difficulties that you deal with being a woman in this field, and it's gotten a little bit better going into cosmetic and aesthetic surgery because that is more female-dominated. However, kind of the quote-unquote old guard, the surgeons that are starting to retire, a lot of them are men. I mean, my mentor was a man, and that's just from the difference in time. And so even that is slightly different. The way he approaches a patient is different than the way I approach a patient. And the way patients talk to me is different than the way they talk to him. It's sad, but it's true. And the differences are subtle. And sometimes they don't really matter. Sometimes they benefit me. And so, especially in cosmetics, especially with breast surgery, which I do a majority of, it's more easy for a woman to express their concerns, their desires, and their insecurities, really, to another woman. That is a more common conversation that we have with women, and so that's easier for them. I always say that when a patient has to show me their breasts or show me their stomach or show me something that they're not happy with, it's very, very emotional for them. It's always a difficult process. And at the end, when I'm finished, I'll usually say, can you imagine doing that in front of a man? And we'll chuckle about it, because that's when it benefits me, right? So I can't say that it's always negative. It's not. So you really have to take the good with the bad, because there are good benefits to being a woman in this field, and there are things that suck about being a woman in this field. But I think the main point of what I'm trying to say, bringing it back, is that you need to mentor others, especially when you're in a career field that's difficult for your similar type of person to get to. So that's what I try to do. And I do mentor men too. I'm not going to act like I don't, because I do. And because surgery in general from a Caribbean medical school, from an international medical school, is difficult. It's very hard to be successful in this field, and it takes a lot. And so people always ask me, you know, why did you do surgery? And it's mainly because I couldn't see myself doing anything else. And that's what I tell other students. I always tell them, if you like surgery and something else equally, do the other thing. And it's not because I'm trying to be like cute or like, oh, you're not good enough, you can't do surgery. It's just that it's a difficult career path. It takes a lot. And if there's something else that you like that will take less from you, time, stress, your soul, do the other thing, because it's not going to take as much from you. And people that are passionate about surgery, people that are passionate about whatever their career choice is, I would say that almost any specialty, you have to have a passion for it in order to be successful, because every single one of them takes something from you. It's just what you're willing to give and how much you're willing to sacrifice for what you want. And in general, I think most people would agree with me that surgical subspecialties, surgical specialties, general surgery take a lot. I won't say they take the most. Okay, but this discussion, I will come back, bringing it back. Sorry, squirrel brain. It's Monday morning, you know. But we're talking about mentorship. I think the other thing about mentorship is that it's really hard to create a mentorship opportunity. That's what I've been working on with the Alumni Association from my med school, about figuring out a way to set up a mentorship like allocation. And it's really difficult because I feel like the best mentors are people that are not assigned to you. It's people that you choose or people that you have a connection with, and that can't be simulated, that can't be created. And that's what I'm struggling with currently. Additionally, we have a numbers difference between like the people that have graduated. There's less of us than the people that are in school attempting to get into residency. And so you also don't want to overload people. It sucks. So most recently what we've decided to do is we're going to basically have people be the head of, not like the head, but they're going to be a part of the interest group that their specialty is. So I'm going to be part of the surgery interest group for our medical school. That way, anyone that is interested in surgery can meet me, hear me talk, ask me questions, get my contact info. And then it can develop or not from there. And then I know other people in our school that have done surgery, so then I can, if there's some, you know, they need something else, they want a different geographical area, because that does really change the experience in my opinion. Or they want someone who wants a different specialty, etc. It is very nuanced in what you want and what you need. So that's sort of my plan. We'll see how that goes. I think we're working on scheduling the first surgery interest group meeting with me. So hopefully that works and helps students who want to get into this difficult field for whatever reason. Silly kids. But that's the plan for now. If anyone has any tips on mentorship and setting that up for medical folks or non-medical, who knows? I would be all ears to try to help people coming out from Trinity. So that's what we've been working on lately. I am currently one of the co-presidents of our Alumni Association and working to kind of build it from the ground. So that's been a difficult challenge, but it's been fun, and kind of creating the board and figuring out what alumni can really help with. I've also done elective rotations, so there have been students from my school that have wanted to get more surgical experience, so they'll come work with me for a month. That's been really fun. It's so great to see young people. It is great to have students or people that are at different levels kind of be around you. I think it definitely makes you better. It makes me really think about what I'm doing and how to explain what I'm doing and why I do what I do. And it's always good to have that kind of reinvigoration, because it whatever you do, anything that you do can become routine, and it can become kind of just basic. And having that infusion of, youth and excitement and wonder. We had a student the other day who is in nursing school, and she's interested in ultimately becoming a CRNA, which I think is a great career path if anyone is interested in that. But she was with us, and she turned to our CRNA, who's been through it all. I mean, she's the best. But she turned to her and she said, "So, what's the worst complication you've ever seen?" CRNA said, "Death, sweetie." And death itself is not funny. Do not misjudge that. That is not funny at all. It is devastating. It is hard. But the way she asked the question, and it just brings you back. The scrub tech and I were talking. It just brings us back to those days where that was you, where you were so just enthralled and like, oh man, this is great. Like, what's the worst thing you've ever seen? It brings you back to those moments of like the first time you ever saw it, or it's just that wonderment, that just like childlike seeing the North Pole. I mean, it was so fun, and it just really, it made me and the scrub tech laugh for about 5 minutes. And it's just because that pure love of what they're seeing and just like igniting their dream. It's so cool. So cool. And it's so easy to forget that you yourself were there. And it just reminded me of the first time I was in the operating room, and the days when I was on an anesthesia rotation, peeking over the curtain, it just being so excited to be there. Sometimes you just forget, and I'm guilty of it too, where it's just like, oh, another day, I gotta go to the OR, when that used to just be like the greatest thing ever. I used to get so excited to be able to go to the operating room. And so it just reminds you of those things, and kind of, makes you grateful for where you get to be. And that was just really fun. So it's things like that I really enjoy having students for. And like I said, they just kind of bring you back to that, grateful state, to be like, man, I remember the days when I was dreaming of standing where I'm standing right now. It's just so cool. So I guess all that to say, mentor people, help people, reach back. When you make it where you want to be, turn around and help others get where they want to be. I was saying, again, bringing it back to the Diddy, they do talk about Tupac and Biggie in the documentary. Again, no spoilers here, but they talk about it. And I remember saying, it's just so sad that they were pitted against each other so horribly, because they were both so supportive of the other, and there was enough room for both. They were different enough that they both could have been famous and at the top. Their styles were different, and it makes me sad, because I know that happens in other things. Like, it doesn't just happen in the East Coast, West Coast rap rivalry. Like, there's room for more of us where you are, so help others. I remember needing a mentor, someone who had been through it, someone who could help me, someone who could answer just my stupid, idiotic questions that made me so anxious and nervous about applications and interviews, and how to be the best intern I could be. And it was really tough finding someone. And then when I did find those people, they were so meaningful and so impactful that they still have a mark on who I am as a person, as a doctor, as a surgeon. So those relationships are so important, both personally and professionally. And I think a lot of times, at least for me, that I have seen in my life, sometimes women aren't as collaborative as we need to be. And I always say, other women treat me worse than other men, or like female patients versus male patients again. And that's just infuriating. And I think that women need to help other women, and we all just need to realize that we're better when we work together. we're more efficient. And honestly, for me, it's really hard to offload my mental load onto other people, to tell them what I need, to ask them to do something for me, because it feels like a weakness. And, you know, I need to be better about it, but also all of us need to be better about accepting that and taking that on, and if we can't, being honest about it and saying, you know, I'm at 90% capacity, I can't take on your 10% right now. And I think if we all can be more like that, it will just make the world go round a little bit better, right? We're here on the road, we're solving the world's problems. Okay, that's what we do. That's what we're doing. We got this. I am getting a little bit too philosophical even for my own liking, so I'm gonna wrap this bad boy up. And I guess all of my, if you could take nothing from this episode, take these two things. Watch the Diddy documentary, tell me your thoughts, and mentor other people. That's all. That's all I have to say. If you have anything you want me to talk about on the road, let me know. Comment, follow, like, subscribe, you know, all the things. Thank you all for being on this journey with me, and I will chat with you next week. Bye-bye.